Okay, I'm about to demo the basic activation exercises. These three exercises are the level 1 introduction to developing hip stabilization. Once you stabilize the hips and the pelvis, you can then begin to stabilize the upper and lower bodies. But we start with the center here at Natural Solutions to establish correct functional movement. If you're a patient of ours, you've already been muscle tested and we've identified the primary exercises. I'm just going to include the three basics that most people need and will benefit from. Some people will need a more in-depth diagnostic and muscle testing to reveal if they need more muscle work, but these three generally will pick up a lot of these smaller structures and get them firing as well. So we use the sentence to serve as an auditory reminder that I ride my bike across the bridge to get the clamps. So if you just remember that sentence and you do it a couple times, you won't forget these three exercises. So I ride my bike is how we're going to strengthen the psoas structure. And I'm just going to use a belt. You can use any belt you have at home. And I'm just going to make a closed loop system. What's important about this exercise, and you'll notice starting at the beginning, we start on our back, much like a baby when they're born, before we even roll over into a crawling position, and then we proceed from crawling to kneeling, through a squat to a standing upright position. So we have a sequence of events that builds upon the basic foundation of one exercise before we introduce the next set. On average, it takes about 2 weeks to really start to yield the benefit of these. So this is going to be the bike exercise to strengthen the psoas. I'm going to lay down on the floor. For the psoas to fire, I must raise this knee above 90 degrees. While I'm executing this, I want to make sure that my hips don't internally or externally rotate, that I actually keep my legs in alignment as if I was walking. Okay? So I'm going to bring this knee up and I'm going to put this loop around this shoe and around this foot. I'm going to lock my right knee up and I'm going to create resistance by just pushing down on my left leg. If you have a hard time firing your core and holding your legs up, you can put a chair to support your legs. What's important is that I'm pulling my knee directly up to my head by using my psoas muscle, and I take 2 breaths and I hold it. And then I relax. Then I repeat. I call this the bike because it's kind of like pulling up the bike pedal if you're clipped in. Okay? The common mistake that people make in this exercise is that they put too much emphasis on their left leg or the resisting leg. It's just for resistance. The leg does not need to be locked out. You don't even have to use your leg. I just need some resistance that's going to pull my knee down. I'll demo this with my left knee. I lock the knee up as close to my chest as possible. I isometrically contract. And I create resistance by just pressing down with my right leg. But I hold and do not let the left leg move. Relax. 2 deep breaths. I do 2 deep breaths because I want to bring my reflexive core firing in so that my abdomen and my transverse abdomen all work with this inner core structure. Okay, so I don't worry about counting, I just worry about 2 good breaths. We can always use better breathing techniques. You'll do those, if they're painful, you'll only do a couple, really light. Like I said, only 40 to 60% of your strength is necessary, and you have to keep the knee above 90 degrees. You'll do 10 to 20 repetitions on one side, and then you'll proceed to the other side. That's the bike. The bridge, which serves to stabilize the glutes on the back side, is the classic bridge you see in a lot of your exercise routines. So I'll lay down, flatten my body, and pushing up through my heels to fire the glutes. So initially I'll pinch my butt together to make sure I'm firing my glutes. The common error here is that people actually push back or curl their legs firing the hamstring. If you get a cramp while you're executing this bridge or any bridge in your hamstring, you're wrong. You're using the hamstring instead of the glutes. So when I do this, I lift my toes up. That helps to isolate the glute and kind of take the hamstring out of the motion. The other error or bad movement people will make is actually hyperextending their lower back. And these will be people that have really tight lower backs because their back is doing the job of the glute. So we want to be careful not to really extend and curve the back, but to keep the hamstrings in the back relaxed as we fire the glutes. So I pinch my bottom, and I roll my butt cheeks up, and to make sure I don't use my hamstrings, I'm going to raise my toes. This helps a lot of people shut down the hamstrings and just use the glutes. So I raise my toes, pinch my bottom, and I bridge up, flattening my torso. 2 deep breaths, and down. And repeat. Keep the shoulders relaxed, arms flat on the floor. Don't be using your neck to brace up. If you think you're using the glutes and you want to check your hip stability, you can lift one leg and move to level 2, which is what I require of my runners, to make sure that you can fire a one-legged glute bridge. And then I'll actually perturb or hit this leg and see if they're wiggling. If you have a lot of side-to-side motion as you do the bridge on 2 legs or 1 leg, you're not stable. And stability is a lack of motion. What we're trying to do is establish stability in the pelvic girdle before we start to teach the rest of the body how to move in relation to one center point. Okay? So that's the bridge. I ride my bike across the bridge to get the clams. The clams are going to be what treats the glute medius and TFLs on the side of the body here. So once again, I'm going to go back to a regular belt. I just happen to have a little PT strap we use. And you'll see that clams can be done with rubber bands in a side lying position. You can do them this way if you want. I'm personally lazy, I don't have much time, and most people want the biggest bang for their buck. So I actually, sticking to the original theory of development, I'm going to start flat on my back. I'm not rolling over yet. I'm going to pull my knees up. I could support my legs on a chair. I place my feet together. The belt's around my knees. And what I'll do is simply pull my knees apart, leaving my feet together, creating contraction of the lateral aspect of my legs. You guessed it. 2 deep breaths, relax. Again, 40 to 60% of my strength. I keep my spine and everything straight. 2 breaths, and relax. I want an isometric contraction, held for 2 breaths. That'll give you, depending on your breath and how deep you breathe, but about 10-second holds, at least 5 to 8 seconds. And we want to get up to 10 to 20 reps. The more the better. The stronger you're going to be, but you got to hold them. This is all about stability, so it's not necessarily about rapid red fibers firing. It's really about isometric contractions and being able to hold you still in space and time while you do more complex motions. Okay, I'll often refer to this in my clinic as the activation or the primer, in which basically every patient gets when they come in with a lower back pain or performance athlete. So hopefully that reminds you, and I'll see you in the clinic.